A 9-year-old female presents to the emergency department for evaluation of palpitations that started abruptly at school about 1 hour ago. She has not had fever, vomiting, or diarrhea, and has had no recent illnesses. Vital signs show heart rate 190, blood pressure 100/70, respiratory rate 18, and pulse ox 98%. She appears anxious with no pallor and normal pulses. ECG shows a rate of 190 beats per minute, absent P waves, and a narrow QRS complex. There is no change following Valsalva maneuver or blowing into an occluded straw. Which of the following is the most appropriate next step? Option A, adenosine administration. Option B, alternative vagal maneuver. Option C, amiodarone administration. Option D, propranolol administration. Option E, synchronized cardioversion. Take 10 seconds. Narrow QRS tachycardia at 190 beats per minute with absent P waves and abrupt onset. This is supraventricular tachycardia. The patient is hemodynamically stable with normal blood pressure and pulses. 2 vagal maneuvers have already failed. What is the drug of choice for stable SVT in a child? The correct answer is A, adenosine administration. This patient has supraventricular tachycardia with adequate perfusion that is refractory to vagal maneuvers. Adenosine is the drug of choice for acute treatment of SVT in children. It is rapidly administered by intravenous injection close to the central circulation, followed immediately by a normal saline flush. It works by slowing the sinus rate and increasing the conduction delay at the AV node, interrupting the reentrant circuit that drives SVT. Important side effects of adenosine include flushing and transient asystole. Warn the patient beforehand. Adenosine may also induce bronchospasm, which can last more than 15 minutes even though the half-life of adenosine is only seconds. Use with caution in patients with asthma. Adenosine can also rarely induce atrial fibrillation, which can be dangerous if the patient has WPW with a rapidly conducting accessory pathway. An alternative vagal maneuver is unlikely to help since 2 maneuvers have already failed. Move on to medical treatment. Synchronized cardioversion is reserved for hemodynamically unstable patients with hypotension, poor perfusion, or altered consciousness. This patient is stable. Amiodarone is reserved for SVT refractory to adenosine and second-line agents, due to its potentially severe side effects including cardiovascular collapse. Key testing point. Supraventricular tachycardia in children presents as narrow QRS tachycardia with absent P waves and abrupt onset. Management follows a stepwise approach. Vagal maneuvers first, then adenosine if maneuvers fail. Adenosine is the drug of choice. Synchronized cardioversion is only for unstable patients. Amiodarone is a last resort. Warn patients about transient asystole and flushing from adenosine, and use with caution in asthma. Follow for daily board questions.